Okay, so good morning. I'm Dr. Jing Jing from Malaysia. So currently I'm working in Subang Dental Specialist Clinic, which consists of 3 stories, and then there's 6 dental chairs in total, and then there are 5 full-time doctors working together, including my boss, which is Dr. 𝙗𝙚𝙛𝙤𝙧𝙀𝙀 DOF mainly is known for the all-in-one wet and dry milling. So what is wet and dry milling? Means like it is a very compact and then slender machine which is combined of the wet milling and dry milling. It is switchable and be installed everywhere, and it doesn't need a big space for the installation. There is this function where you can mill your 𝙘𝙦𝙦 in a submerged water bath, so we call submerged milling. So for the submerged milling, actually they will provide a water bath which you have to place it in the machine before you start the milling. So when they mill, they either mill PMMA or like mill the 𝙘𝙦𝙦 in the water. So for that, it will increase the tool life, and then means the tool won't worn out so fast and it can sustain longer. So by having submerged milling, we can mill very precise and then very accurate and fine detailings of the crown to produce a better anatomy and fits of margin of the restoration. And then another plus point is they have those 5-axis milling machinery technologies where they claim to have 5 axes of AB axis and then XYZ axis, which can produce an excellent fit and also can mill up to different shape without any restriction. Yeah. One of the features that I like the most is the touch screen and then the computer built-in system, where it's very easy in handling. So with the built-in computer and touchscreen system, we can easily keep track with the tool maintenance, where it will show like when should we change a new tool, and then they will also show that the tool wear and also the breakage, where it reminds us when to change for a new burr or tools. Normally, our clinic, usually we do a lot of restoration work. Most of it, we will mill zirconia using the dry milling system, and then also we will mill 𝙘𝙦𝙦, lithium disilicate, crowns, onlays and inlays, PMMA, or even like the pre-mill abutment using the wet milling, where we will insert the water bath to facilitate the function of the submerged milling. Normally, in our practice, we will usually carry out dry milling in the morning, which we will mill out zirconia in the morning, and then after we have finished it, maybe in the afternoon only we will switch to wet milling, which is milling the 𝙘𝙦𝙦 crown, onlay, inlays, or any PMMA for temporaries, so that it will ease our procedure. And also after we have done with the wet milling, normally we will just like do some maintenance over the machines, and then we will wait for another day. Once the machine is totally dry, only we will start again with the dry milling with the zirconia. So for this picture, normally we will try to mill those anterior crowns, which we need to focusing on creating those anterior textures, anatomy, and then also like to provide aesthetically pleasing results. So normally we will give more attention to those buccal surface, and then to have a better margin, gum lines, and also the interproximal areas. So by having a precise milling, we can save our working time in refining the final restoration. I'm pretty sure for the main consideration in buying a product as a consumer is the before and after sales service. So for this, I'm very proud of DOF, which they really provide a good service, and also behind they have a very good support systems, which when you encounter any problem, they are just one text away or a call away, then they will try to settle or troubleshoot your problem immediately. So I feel like the service is very important. So with proper usage and also maintenance of the machine, sustain the machine in the long run.